Welcome to Innovative Renal Care.
Bienvenido a nuestro centro de diálisis.
Innovative Renal Care provides quality service for patient care. It's very patient-oriented, very patient-focused.
We have a very loving crew of dialysis technicians, nurses, dietitians. Our medical director is fabulous.
We offer in-center HD. We also have PD, which is peritoneal dialysis. We offer HHD, which is home hemodialysis, using the home next stage.
The patients get to know their staff, and the staff get to know their patients. They build a rapport and excellence of care. We hold a standard of expectation on the services and the care that's being provided for our patients.
Each time you arrive for treatment, your nurse or your technician will walk you to the scale. We will get you weighed. We are going to get your blood pressure, take your vitals. The nurse will assess you, listen to your lungs, listen to your heart rate. Your PCT will get your blood pressure, and then we will get everything started.
I'm a patient care technician. I help assist the patient when they come to treatment, and then we reinforce educations for the patient for fluid restrictions, and then I do also the scheduling and so as assessing access for the patient.
The diet specific for kidney patients on dialysis differs from patient to patient. When I work with you, I will sit down and look at your lab values. Specifically, some nutrients such as potassium and phosphorus become important, and we will tailor your diet to how your lab values reflect. I work with the physician, the social worker, the nurse practitioner, as well as the nurses and your techs. We make it a collaborative approach, whether it be reviewing your labs. If you have any questions regarding diet, to relay the information to me so I can meet with you or your families in order to feel your best along your treatment.
When a patient first starts, there's a lot of nerves and fear because it's a big change, it's a big process. So a lot of my job when a patient first starts is education and kindness and just reassurance that everything is going to be okay. I think one of the first things that patients have questions about has to do with transplant. So that is always one of the first things I explore with them. It's a long process, so I hold their hand through the whole thing. I do a lot of insurance support, financial education, connecting patients to resources.
I ensure that all of our machine and water equipment is running safely. I do all the preventative maintenance and any maintenance if we have issues with any of our equipment. Water safety is one of the biggest components in our clinic. That's what the machines run off of. I'm responsible for making sure the maintenance is done on our system and that it's continuously running. Cultures are drawn on water monthly, and twice a year we send water out for AMI results, which basically gives us an idea on the water that we're treating and the product water that we're making.
The home therapies patients choose so they can be more autonomous, and they are responsible for doing the home therapies by themselves at home. I do a pre-home visit to make sure they have adequate storage area for the supplies. I will show them the supplies that would be coming to their house. Some patients prefer to do the peritoneal dialysis, which is 7 days a week at night while they're asleep. And then my home hemodialysis patients do it 5 days a week to keep the fluids down. And that typically takes about 3 hours, 5 days a week. With the peritoneal dialysis, the patients come and see me for monthly labs, and then they also come to see the doctor once a month. So typically it's 2 visits a month. For the home hemo patients, they draw their own labs. So they typically come once a month to see the doctor, and we go over all of their labs and diet with the social worker and the dietitian also. The one thing that I really particularly like about the home therapies is it gives the patients more autonomy in traveling. Peritoneal dialysis, they just need a few weeks notice so that the supplies can be delivered to their destination. We provide a carrying case for the cycler. If you're traveling by air, TSA is required to let you take the machine with you on the plane. It doesn't go into baggage, and the airlines have been very accommodating for their cycler and such, since it's a medical device. As far as the home hemo patients, some of them choose to take their cycler during their trips, And we also provide a carrying case for them as well. I personally feel that it gives the patients more autonomy and control over their life because they can go about their daily activities without having a 3-day-a-week appointment that they have to be to.
At Innovative Renal Care, our mission is to deliver more tomorrows through compassionate, high-quality kidney care. When you arrive, you'll be greeted by our friendly front desk team. They'll help you check in and answer any questions. We pride ourselves on creating a welcoming, comfortable, and respectful environment. Our dialysis stations are equipped with state-of-the-art technology and designed with patient comfort and privacy in mind. Each station includes access to entertainment and space for personal items. We will assist you in administering your treatment.